Dr. Ivan Turpin explains the process of undergoing plastic surgery.
I've been in practice over 20 years now and have done numerous mastectomies, reconstructions rather, and these women come in and there's 3 or 4 common concerns that women have. One, they want to get rid of that external prosthesis. It gets hot, especially in the summer when they've got their feeling back in their chest, and others want to eliminate the prosthesis so they can have more freedom with the clothes they wear. Many of them just want to minimize the post-operative depression that they experience after the ablative procedure. Waking up with an immediate reconstruction and having a mound there that is comforting to some women, not seeing a depression or a radical excision like in days past. A skin-sparing mastectomy is very common nowadays. This is where the surgeon who's doing the mastectomy is able to keep virtually all the skin. All it takes is the nipple and areolar complex. Sometimes we modify the pattern a little bit, but we are able to preserve more skin. In the initial days, 100 years ago, we felt that curing cancer required a very radical ablative procedure. But as studies have shown that we can do less and less, and the more tissue saved, the greater the result we can get in plastic surgery. That's probably the single most important advance in the last 10 years for plastic surgeons, is that they're leaving us better tissue to work with, so our reconstructions have improved dramatically. In the last 10 years, there's been a dramatic improvement. We use silicone implants or saline implants nowadays. Some patients, in my patient population, they split that about 50-50. Some choose silicone, some choose saline. Many I advise one way or the other depending on the clinical situation. But there has been the tram flaps, of course. There are no implants at all. It's just reconstruction with the tissues from the lower abdomen. Nipple reconstruction has been done for a variety of ways. We used to, in the early days, we'd preserve the old nipple. I don't use it at all. I don't think it's worth the risk of trying to preserve that nipple, since the reconstructed nipples that are made from the chest wall are much better. I have my own personal ideas of how nipple reconstruction should be done, and then this is followed by tattooing a few months later. Overall, the whole process of reconstruction and through the tattooing takes between 1 and 1.5 years. I feel you shouldn't rush things, because the faster you progress, you get nipples in the wrong place. You can't get as fine an aesthetic result as if you allow tissues to mature and settle and into a more normal position. These women, I've gotten so many nice notes and comments about how thankful they are. It's just made them whole again. Just words can't explain some of the nice thoughts and comments I get from patients on how thankful they were they went ahead with it. They were reluctant, and now they're thankful they did, and it's over, and it's not as good as the original, but many of them can be very close. And when they're dressed and in their clothes, it's hard-pressed to tell they've ever had a mastectomy, and that's what allows them to go on with life and get this cancer business behind them.